Hey guys, today I'm going to tell you how to answer roleplay scenarios and provide the perfect answer for your interviews. I'm also going to be going through an example roleplay and give a model answer at the very end, so make sure you stick around for that. And just before I get into the video, I'd really appreciate it if you could like, comment, subscribe, and hit the notification bell down below to stay up to date with all my videos. We're getting right into interview season and I'm doing a load of videos covering how to answer interview questions, so really make sure that you subscribe so you can stay up to date with all my videos and hit that notification bell so that it comes right in your sub box the second you open your YouTube. So without wasting any time, my first tip is to make sure that you read the roleplay fully. A lot of the time people try and go into these interviews and read the roleplay very quickly so they have more time to think, but you're better off just taking a second, reading the entire scenario first, and then starting to formulate what you want to say. Bear in mind that some of these roleplays can be quite complicated and they can have more than one section to them. There might be a few issues that you need to tackle. So by taking the time out to read the question fully and read the scenario fully, you'll really ensure that you don't miss any of the important parts, and when you provide your answer, you provide the best answer possible. I know this sounds very obvious, but just really make sure you do it, because a lot of people just think, cool, I'm just going to read the scenario very quickly. They see like a main issue and they start answering when there's actually like a secondary problem that you have to identify. The next thing I'd recommend you do is engage in active listening. So active listening is a listening technique that ensures that you stay very engaged in the conversation. And the way that you can show that you're actively listening is by referring to the three components of active listening. The first one being comprehension. This means that you as a listener are paying attention to the verbal and non-verbal communication of the person in front of you. Within this, you're trying to understand the reasoning behind one of the issues they may have, or just listening to the key pieces of information that they're providing you. The next component of active listening is retention. So this is making sure that you retain any key information that's provided to you. You can do so by just committing it to your memory or even making notes. In doing so, it actually allows you to take note of some of the issues that your patient may be having and ask questions about them later. And the last element is responding. So this one's quite self-explanatory. After you've comprehended what they've said and you've retained key bits of information, you actually have to provide a solution or respond to the issue that they've presented. Doing this will show a patient that you've really taken into account the issues that they have and that you're being specific to the problems that they may be facing. Some of the best ways that you can show the interviewer or actor that you're actively listening is by maintaining eye contact, nodding, and paraphrasing. And with paraphrasing, it can simply be just repeating some of the things that have been said in the role play. So for example, let's say the actor is playing the patient and the patient says, oh, I've really been suffering with toothache for like the last few weeks and it's really causing me a lot of pain. So a bad way of answering this would be just trying to go straight for the treatment. So saying something like, oh, so we can do an extraction or a root canal. A better way of answering this can be through active listening and paraphrasing. So I'd say something like, oh, so you're saying that your tooth has been hurting for the last few weeks, is that correct? And then the patient would respond, and then you'd potentially talk about your treatments or your treatment plan going forward. This is a very key skill that you have to show in your interviews, and it really differentiates the very, very good candidate. My next tip is to talk less, listen more. Listening is so important because you have got no information about the person in front of you until you listen to the concerns that they have. You might encounter a scenario that you might have done in your practice and be like, oh yeah, I know exactly what to say, but it can actually backfire because it makes you just talk too much and you're trying to say like too many educational points or just try and sound too smart. A lot of the time the interviewer or the actor is just looking for you to listen to what they're saying and listen to their concern, show that you've understood their concerns, and then potentially give the information or give a solution. So in some situations you might actually have to be quiet and just not talk. So let's say you've just broken some bad news to a patient. You need to give the patient time to process the bad news. So just try to remember that sometimes silence is good, and don't worry about just trying to spit as many facts as possible in your role plays. And leading on from this, I go into my next tip, which is make sure that you show that you're empathetic. Here you're experiencing the person's feelings and you're trying to put yourself in their shoes. I know it's like a really common way of understanding it, but it's just a very, very good way of visualizing empathy, just putting yourself in someone else's shoes. So one of the ways that you can actually show empathy is by adapting your tone. So for example, let's say that you've just broken some bad news. You're going to want to do so in a softer tone and a bit slower, because through your empathy skills, you've identified that this news is going to be quite worrying and upsetting for the patient. So you want to break it down a bit slower than you usually would. Another way of showing empathy is by identifying the feelings that the patient may be having. So not only are you just adapting your tone, but you're also asking the patient or identifying the problems they may have. So let's say you're giving the patient some bad news, saying something like, oh, would you like a tissue or would you like some water? Shows that you've understood that they're feeling upset or frustrated at this moment, and you're trying to remedy this by doing a particular action. Little things like that can really show the interviewer that you're showing your empathy skills and you've identified what the patient or the person in front of you is going through, and that can really help your cause when it comes to answering this question. My penultimate tip is to make sure that you educate your patients. So there'll be quite a few scenarios where it'll be a dentist and patient interaction, and within this, people think that, okay, I just need to give the treatment options and leave it there and let the patient decide what they want to do. But a lot of the time in these role plays, it's not just stating that there's treatments available, it's not just stating that this is what you can do. These role plays, the interviewers are looking for a bit more. They're trying to see if you're actively trying to educate the patient. So trying to explain procedures properly, telling them where they can find out some more information about a procedure that you recommended, and even things like reducing the amount of jargon that you use so that the patient truly understands the information that's being provided to them. And by jargon, I just mean using overly complex terminology or medical terminology, dental terminology that the patient may not necessarily understand. And within this education element, you also need to make sure that the patient understands understands what you're talking about. So just asking them questions to see if they've really comprehended what you've said will really help you go a long way in these role plays. And my final tip is to make sure that you resolve the issue or you find a solution. So some common role plays that you may have are things like breaking bad news or dealing with an upset patient. With both of these, there's some conflict resolution. So in breaking bad news, you might have done something wrong that's caused your treatment to go badly, and you need to break this news to the patient. Or you might just be breaking some bad news about a disease or an illness that they may have. And within this, it's all well and good talking through this and showing empathy, but at the end of the day, you need to find a solution for the problem. Similarly, you might have to deal with other scenarios with like upset patients, and again, you need to have conflict resolution here and find a solution for the problem they have. And by keeping this idea of like conflict resolution and finding a solution at the back of your head, it will really help your answer be more grounded, because a lot of the time people are trying to be like really abstract and just show their empathy skills, and they're really trying to force the emotional skills when it comes to these role plays, but they forget that the most important thing is to actually find the solution for the patient in front of you or for the person that's there. And on top of just finding solutions, you also need to be able to outline the next steps of the potential treatment or the next steps of the scenario that you have. So those are my top tips. Now I'm going to be going through an example role play so you can see how they might be structured this year in your online interviews. Okay, so I'm going to be going through a role play now. I have the role play up here, so make sure you pause now so you can read the whole thing. Give it a sec. It's quite a long one. Actually, now I realise you don't really have to pause, but oh well, there you go. Cool. And I'm going to get straight into the answer now. Hello, Mr. Jones. My name is Dr. Asayed. I'll be taking care of you today. First things first, how are you feeling today? Yeah, I'm feeling alright. I think last week I came in for like some sort of sample, or we did something like sort of test last week, and I just got a call the other day saying that I need to get that checked. I think that's what's happening today. Oh, okay, so you're referring to the biopsy that you took last week, if I'm not mistaken? Yeah, I think it's something like that, biopsy, or yeah, that sounds about right. So yeah, so last week they just took a sample because they were just going to do some testing on it to just see if there's like any underlying conditions that we need to be aware of. And I've got the results here. Would you like to go through them now, or would you like a family member in the room first? No, just go ahead, yeah. I just really want to hear this, like get this over and done with, because I've just been a bit worried about it, to be honest with you. Okay, Mr. Jones, so with regards to the results, I do have some bad news, unfortunately. We actually have found the indications of oral cancer in your system. Oh wow, okay, I didn't expect that, to be honest. Wow. That is a lot to take in, to be honest. I can understand you must be quite upset at the moment. Would you like any water or some tissues? Yeah, water would actually be great. Thank you so much. Okay, so you said cancer, like said oral cancer. What does this mean? Does this mean I'm gonna die, or what's gonna happen? I know this must be devastating news, and at the practice here we're going to be trying to provide the best quality of care that we can to ensure that you get through this as best as possible. Unfortunately, nothing is 100% and nothing is determined, but thankfully we have found and detected this oral cancer quite early, so hopefully with the treatment plan that we implement we can provide the best solution possible. So what does this mean? What do I do next? Do I have to get any treatment? Do I have to like chemotherapy, radiotherapy? Like, what's happening now? So with regards to your treatment, this will actually be discussed at your next appointment, where we will be constructing a treatment plan that is tailored to you and your needs and the progression of your oral cancer. I can't tell you at the moment what the treatment is going to involve. However, rest assured that we will be providing the best care that we possibly can. And again, Mr. Jones, I know this can be quite difficult and quite upsetting news, but I just do want to let you know one of the positives is that we have detected this quite early. Okay, so is there like anywhere I can just find out a bit more about this, like just read up on it, or like just find out a bit more about what's happening? Okay, so just to clarify, you just want to find out a bit more about the condition? Yeah, I just want to find out a bit more, like I just don't know what's about, like what's happening. Okay, if you'd just like to find out a bit more and just gain some insight into the condition you have, we actually do have some leaflets here, and if you do check the practice website, we do go through all the different treatment plans that we might potentially be going down. As I mentioned earlier, I will be going through a more extensive treatment plan that is tailored to you next week. Okay, thank you so much, Dr. Asayed. That's really helped me out. I still think it's going to take some time to get over this, but I really hope that we can just get this treatment sorted as soon as possible. I can totally appreciate how difficult this must be, Mr. Jones, and from myself, I really want to ensure that you feel that you're safe at this practice and that we'll be doing the best we can to provide you with the best treatment. Do you have any questions that you'd like to ask, or anything else that you'd like me to explain a bit further? No, I think I understand. I think you covered everything. Thank you very much. So yeah, so that's an example roleplay for you guys. One thing that I just add on to my tips I didn't say at the beginning was just to ensure that you introduce yourself when it comes to the scenarios. This is just a really basic thing that you can do to ensure that you establish a little bit of rapport with your patient, and you'd introduce yourself as the person in the scenario, not as the interviewee. I hope that makes sense. Just as I did in that scenario, I introduced myself as Dr. Asayed, even though I'm not actually like a qualified dentist yet. And lastly, I just want to say, if you enjoyed that video, I'd really appreciate it if you could like, comment, subscribe, and hit the notification down below to stay up to date with all the videos that I make. I know a lot of you are sitting your interviews soon, so make sure that you turn the notification bell on so you can see every time that I upload my videos and get them the second they're out. And thank you for watching.